Welcome to Genetic Disorders Weekly with your hosts, Sachi and Sophie.
Today we're going to be talking about sickle cell anemia, a blood disorder that people have been requesting us to talk about recently.
Let's go to our expert, Abby Greenberg, in the field.
In people who have sickle cell anemia, cells are pulled out of shape by hemoglobin S forming strands. Normal cells are disc-shaped, but sickle cells are crescent-shaped and stiff. This means they get stuck easily in blood vessels and can block blood flow. That's not good.
Diagnosing sickle cell anemia is fairly easy, as a simple blood test done at any time can determine if you have the disorder. It can also be determined before birth using a sample of tissue from the placenta.
How is it treated?
While there is no cure for sickle cell anemia, a few ways to treat it are gene therapy, which is the use of DNA as a drug to treat diseases by delivering therapeutic DNA to a person's cell, bone marrow transplants, blood transfusions, which can be extremely dangerous for sickle cell patients, and providing maximum comfort to the patient. Folic acid and vitamin supplements can be prescribed. A breakthrough with hydroxia, a cancer-fighting medication, allows doctors to reduce the severity of the disorder. A few golden rules for patients are: always stay hydrated, as dehydration is a huge problem for patients. Smoking is a huge no-no, as your blood already has trouble carrying oxygen, and that can greatly worsen the problem. It'd be wise to avoid high movement activities such as sports. So Sachi, how does it hurt them, and what can their caretakers do to help?
Well, sickle cell anemia creates severe pain in several parts of the body, such as chest, limbs, and the abdomen. Stroke, severe difficulty breathing, and kidney failure, and an increased risk of infections could also occur. A very severe form of lung failure called sickle chest syndrome is common in sickle cell patients. Occasionally, the bone marrow shuts down and the patient is unable to make any new blood cells. This is dangerous because the sickle cells have a shorter lifespan than the regular red blood cells.
And the caretakers?
Well, their job is to make sure that they don't do any heavy activity, they take their medicine, and they're comfortable in their daily life.
All right then. To understand the demographics and populations it affects, let's go to our field reporter, Jose.
Sickle cell affects men and women, but mainly people in the Mediterranean area. People with sickle cell usually have darker skin tone. It is an autosomal trait, meaning it is not X-linked. If you are heterozygous, you're a carrier. If you're homozygous dominant, you don't have it, but if you're homozygous recessive, you do have it.
If your parents are both carriers, there's a 50% chance that you'll be a carrier of sickle cell, 25% chance you won't have the disorder, and 25% chance you will have the disorder. If one parent is a carrier and the other is not, there's a 50% chance that you will be a carrier and 50% chance that you won't have the disorder.
Sickle cell affects all organs because of blood clots, but it mainly affects the liver, bone marrow, and heart. It affects the liver because the liver has blood being filtered, and it's hard for it to filter sickle blood. It affects the bone marrow because the bone marrow produces blood cells, and it makes it difficult to produce the blood. It affects the heart the most because it is very hard to pump sickle blood cells, putting strain on the heart. Thanks for watching Genetic Disorders Weekly. This has been Sachi and Sophie. Bye! So, Abby, what is... forgot the name of it. Jose. Transplants, blood transfusions, which can be very deadly for sickle cell patients, and providing maximum comfort to the patient. Folic acid and vitamin supplements can be prescribed.
Can be very deadly or very dangerous.
You're supposed to say something.
Right.
All
right.
I don't know what to say for the first sentence.